Comfort Care Hospice, a leader in providing hospice-related services throughout the entire DFW Metroplex. Our second sponsor is Dallas Renal Group, a physician group that Dr. Vik Prakash and I belong to. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on dallasrenalgroup.com or on the Dallas Renal Group Facebook page. My name is Dr. Silvi Simon, and I'm co-hosting today's show with Dr. Vik Prakash. We are live in the studio with Dr. Claude Denham and Dr. Kartik Konduri discussing lung cancers. The number to the studio is 972-235-5555. Let's see, we already have live callers. Let's take the first call. Hi, welcome to Doc Talk. What's your question? No, sir. Hi, welcome to Doc Talk. What's your question? Sure. Dr. Konduri, can you take that question?
Sure. So that's a great question. So as I was mentioning in the prior segment, smoking, of course, is the most common cause, but there are other risks, particularly radon exposure. And radon is a gas that you can't smell or can't see, but it collects in houses and basements, etc. So there's ways to test it. Radon is a known carcinogen and is known to cause lung cancer. Asbestos exposure, other things that can cause this include exposure to minerals and elements like berylliosis and diesel exhaust fumes and so many other chemicals that one can inhale. But there is a significant proportion of patients in the United States and of course across the world right now where 20 to 25% in the US now are diagnosed with lung cancer, and we can't really pinpoint a particular cause. There is some familial risk of lung cancer that has been touted and discussed about, but in a sense these people who are roughly about 45 to 50 or maybe even 50,000 or more patients per year have never smoked and don't have any significant exposure to people who have smoked. So there are very many risk factors definitely that can be cut out. Cigarette smoking is primarily still the most important risk factor, but as I mentioned.
I think the caller had a second part and he asked
yes.
What symptoms are common with lung cancer?
So that's another good question. As I mentioned previously, the one issue about lung cancer is that the disease is inside the chest. It's not something you can see, feel, touch easily. Many times the disease grows without any significant symptoms in the beginning, and when it does present, it can be associated with a cough or significant shortness of breath. Someone can have some coughing up of blood. Other circumstances like pain because the tumor has spread somewhere, or issues in terms of weakness and fatigue and weight loss, etc., can also be symptoms that are associated with this disease.
Great. Let's take a live caller. Hi, welcome to Doc Talk. What's your question?
Sure. Well, cutting down does decrease your risk because it is the risk is related to the duration as well as of smoking as well as the number of cigarettes smoked daily. I think the real concern about trying to cut back to one or two is just given how addictive nicotine can be. It's very hard for some people to limit it, and sometimes there'll be triggers in their daily routine that will make them want to smoke cigarettes more often. So I think that's one of the major concerns to trying to just cut back. But one or two a month or a week is substantially less risk than a pack a day.
And I also wanted to ask my own question as far as, there's a lot of people that don't per se smoke cigarettes, but they chew tobacco, and there's this new thing with vaping. Can you comment on that? I know some of the callers over the break had a question of that.
Sure. I would think of those differently. Vaping is really just a nicotine delivery device, like nicotine patches or nicotine gum, and those are well-established ways for many people to quit smoking, to get them through that craving for nicotine. It's important, though, to realize that if you use a nicotine delivery device like patches, you cannot smoke while you're wearing the patch, otherwise there's a risk of heart problems. So vaping does not cause lung cancer, and it can be a helpful way for some people to quit smoking. Chewing tobacco, on the other hand, is a totally different problem because there is a risk from the carcinogens in chewing tobacco, primarily to cause mouth cancer. So
Which we have a whole segment on coming
absolutely,
up in a few weeks.
yes, it can be a very serious form of cancer.
Let's take another live caller. Hi, welcome to Doc Talk. What's your question? Yes. Smoking marijuana?
So that's a good question. One has to realize that marijuana studies are not significantly present because it's not been legitimate in the United States for a long period of time. If you look at the American Cancer Society website, the marijuana is considered to have some level of a risk. And primarily, it's not necessarily because of the marijuana alone, but there's the tar, that is the substance that you inhale along when you smoke marijuana, that can potentially collect in the lungs and therefore has a prevalent risk of inciting lung cancer. How much of it and how much of a dose of marijuana or how long a period of marijuana use would cause this is very difficult to contemplate because there are no studies for us to talk about them particularly.
Dr. Konduri, what's the population that should be screened for lung cancer, and is it important to detect it early?
Yeah, so that's a very good question. Lung cancer screening has just come into vogue for the last few years, and it has become an established way of trying to reduce lung cancer related deaths. Prior to CT screening for lung cancer, there was no particular way of testing it. Many people did chest x-rays and there was no significant benefit of it. There was a large trial called the National Lung Screening Trial, which particularly used a certain set of parameters and cutoffs, and that's generally what many of the societies and guideline creating agencies use. In a sense, 55 to 80-year-old people who have at least a 30-pack year smoking history, and if they have quit, they should have quit within the last 15 years, would qualify for CT screening evaluations for lung cancer.
All right, thank you. Let's take a live caller. Hi, welcome to Doc Talk. What's your question? Hi, welcome to Doc Talk. What's your question? Uh-huh. Dr. Denham would like to answer that question.
Well, sure. Yeah, I mean that's certainly an important issue in all of healthcare. Is who do you trust your physician in the hospital that where you get your care? Within the cancer community, we have guidelines that are established by national bodies. For example, the American Society of Clinical Oncology, or ASCO, as well as the NCCN, which is the National Comprehensive Cancer Network, comes up with a very regularly updated list of what they consider to be the standards for treatment of a variety of different cancers. And they set sort of parameters for what's appropriate and what's not. Now, it's not cookbook medicine. There are a variety of different scenarios that cannot be addressed by guidelines. But as long as it's within those guidelines, we typically consider that to be valuable therapies.
So I echo everything that Dr. Denham said, and I would just like to say one thing. If you have a question, ask that question. Figure out if you're comfortable with what your doctor is talking about. Ask for another opinion if you so wish to, and find out what the doctor is trying to do for you and how it fits with the national guidelines as Dr. Denham is talking about.
Great advice, guys. Let's take another live caller. Hi, welcome to Doc Talk. What's your question? Sure, that's a great question. Dr. Konduri?
Sure, that's an excellent question. So, familial risk has been talked about in lung cancer, and there are certain families where there seems to be an increased prevalence of lung cancer in spite of the fact that one discounts secondhand smoking. Of course, it's very hard to delineate the distinction between secondhand smoking in a family and how much exposure you have in such scenarios, and then clearly talk about lung cancer as a genetic factor. But I will tell you that there are studies that are ongoing in certain of the large universities, including Harvard, etc., where there are patients who have never smoked and have lung cancer, and their family members have lung cancer too. So there is a evaluation ongoing. I can't tell you that there is a particular test that is commercially available at this point of time that one could use. However, there is definitely work in progress, so stay tuned.
Okay, let's take a live caller. Hi, welcome to Doc Talk. What's your question? Sure, that's a good question. Dr. Denham?
Yeah, sure. So small cell lung cancer is a little different than the more common types of cancers in that there's a very limited role for surgery, but it is very sensitive to chemotherapy, and probably 3/4 of the time will shrink dramatically with chemotherapy, sometimes go away to where you don't see it on the scans anymore. Unfortunately, there is a very high risk of it coming back or progressing at some point in the future, but it can vary tremendously from person to person. There are some patients whose cancers can be controlled with a variety of treatments and can live 3, 4, 5, 7 years or longer with it. Other times it can return, within about 3 or 4 months after it's diagnosed. So there's a great deal of variability.
Dr. Konduri, we frequently get asked by callers, is there anything they can do naturally? Are there certain foods they can ingest which would help reduce the risk of cancer or help in the process of cancer therapy? Could you comment on that?
Yes, it's a frequently asked question, and for good reason. One wants to know about natural ways to try to fight cancer. I would say that eating a healthy diet, and if possible, doing exercise within one's means, having an evaluation for general health checkups, etc., are fine. I'm not so sure that there is any particular diet that one can potentially talk about that reduces the risk of lung cancer. There have been actually some studies which have suggested that things like alpha-beta carotene, etc., might have actually an inherent detrimental risk for lung cancer. However, in the general scheme of certain things that Dr. Denham and I see, I think I can speak for both of us to say that we generally tell patients to eat healthy, and particularly not have a necessary fad or a restriction or a particular food diet or group that they have to use.
All right, folks, we're approaching the end of our show. Remember to log on to our website, doctalklive.com, to obtain more information about this week's experts and next week's. Also, don't forget to like, comment, and subscribe to our new YouTube channel, Doc Talk Live. Dr. Denham, Dr. Konduri, we've got about 30 seconds left. Any last-minute information that you want to share?
Well, I think this has been a great series of questions and highlighted a lot of people's important concerns. Should any questions come up, we're available at our website, which is TexasOncology.com is the website for the oncology group that we belong to.
All right, DFW, stay healthy.